thank you for joining this panel entitled Patient-Centered Care Beyond the Buzzword. Patient-centered care is certainly a term that is used quite a bit, but what does it really mean? And in this multidisciplinary panel, we'll spend some time discussing all the different aspects of patient-centered care and how we can best deliver it. As you can all see from the panel members, we have geographic and professional diversity, so I think this should make for a wonderful dialogue on patient-centered care, and certainly scalp cooling is one of our tools for mitigating side effects. However, in this panel, we'll be talking even more broadly in terms of how do we personalize care? How do we deliver patient-centered care? Is it just a buzzword? Is it a theoretical framework that we toss around? How do we actually execute it? So that will be the overall our theme. So I will start out with our first question to get us going, which is what does patient-centered care mean to each of the panel members? For me, it's personalized care. It's a dialogue that includes shared decision making, and that both sides, both the clinician and the patient, fully understand all the options that are available, that they understand the limitations of what the options are, as well as we're taking the time to hear each other in terms of different preferences. So with that, maybe I'll turn over to Tricia to hear your perspectives on patient-centered care.
I think that patient-centered care is really a lot about what you just mentioned, but I also see it as it's a little bit different for the nurse, and I think part of that is that it's really respecting the patient's wishes, and sometimes that means pushing back on what we think is in our value system, and not even necessarily sometimes in our value system, but we sometimes look through a lens of medicine and what we've seen in the past, and we forget that this is could be the patient's first journey, or it could be they've had many journeys through cancer with family members or themselves, and we really need to take a step back from what we think is right and what we hold as values and open ourselves up to listen to the patient and what they want.
Such an important point. Exactly. And I think one of the dangers can be that as nurses and clinicians gain more experience over the years, we kind of can get into this mindset that, well, we've seen it all, we know this. And really, you make such an important point of just realizing that this is the first time for that patient, and that they can take their time and really ask the questions that they need. So thank you for bringing those important points up. Preeti, do you want to go next in terms of kind of from a surgical perspective, particularly additional considerations?
I couldn't agree more with Tricia's statements. I think it's important for us to realize as the clinicians that no two patients are the same and no two cancers are the same. And I do explain that to patients because sometimes they'll come in with a preconceived notion of how things are going to go for them based on their neighbor or their friend that they know that has breast cancer diagnosis. And, even though I might look at the patient's, biopsy results, imaging, and everything in advance and know in my mind, with my experience, this is the right plan for the patient, it's important for me to also go through the whole gamut of with them, because I may think she should definitely do bilateral mastectomies looking at this imaging, but the patient may have her own reservations about that. It's important to explain alternatives while still remaining within the guidelines of care that's, safe and proven. And sometimes it's surprising, they may have a preference that you may not be expecting. And being able to open up space and take pause in these conversations, not make it one-sided monologue, allowing patients the opportunity to ask questions and to, get their feedback. What are you feeling right now? What are you thinking of this plan? Are you comfortable with this plan? I think that's really at the heart of what patient-centric care is also being considerate of their goals. While us being the experts in the field, we want to also guide them along the way and not let them lead themselves astray.
That balance, exactly. Obviously we provide, certain clinical expertise, obviously from years of experience, and it's important for us to be their guides, just as you mentioned, while taking into account their preferences. So thank you for bringing those points up. Jayoti, tell us your impressions.
Right. So, I completely, in sync and agree with the house, what is being said. So in my opinion, in patient-centered care, essentially patients and families, they are partner to the care providers, and, their wishes and wills towards what is their expectation towards their health-related outcomes, their treatment plan, etc., plays a very vital role, rather, I would say, driving force. And clinicians, not only treat patient or tumor per se, but also treat these patients emotionally, spiritually, financially, all those aspects. So holistic care, I would say, and wherein patients, families, and clinicians all are the partners towards a decision making.
Thank you. No, I completely agree.